in all of that we do, whether it's the classroom, the research, our community, partnerships, our service, everything that we do has that thread of a goal of moving towards health equity.
Audrey Shillington is the Dean of San Jose State University's College of Health and Human Sciences. She says the students will not only get a solid hands-on education in the field of their choice, but will also be given the tools to be empathetic in their professional practice.
They will find that there will be content related to how do we address, policy changes to make sure that services are better for the people that we're serving, or that the systems need to be changed, or understanding what the barriers are to someone who is needing physical mobility help.
The College of Health and Human Sciences is primarily made up of 7 departments: audiology, kinesiology, nutrition, food science and packaging, occupational therapy, public health, social work, and the Valley Foundation School of Nursing. Each department focuses on their primary mission of preparing students for the workforce, with that overarching message of health equity being supported by 3 practical pillars.
In service of this goal of health equity, we are committed to interprofessional education and practice. And then we are also committed to health technology for health equity. We also call that health tequity. And then the third one is community engaged and community partnered.
For example, students from nutrition and food science might learn alongside students from public health. Cutting-edge health technology is used by audiology students for hearing assessments, and kinesiology exposes students to state-of-the-art physical testing equipment. Finally, the occupational therapy department holds weekly physical disabilities clinics, pediatric clinics, and older adult clinics for the community.
The hope is that our students are graduating with a passion for caregiving, that you're aware of, biases, that you're aware of, systemic challenges that, different populations, different people, different families experience.
San Jose State prepared me with the skill sets to advocate for policy change, to making sure to address issues about racial health equity that exist in our community, as well as prepared with the knowledge and skill sets to build community health programs that are targeted towards the individuals that most need the help the most here in San Jose.
Some of our assignments encourage us to speak to politicians and get nursing policies on their radar or awareness, and so we do the research behind it of what benefits our clinics and what we've been seeing on the ground level and informing our politicians.
San Jose State's social work program really emphasizes the transcultural perspective, and there was something that stood out. Positionality, so understanding your role and working with vulnerable populations and kind of the power you do hold.
And being in Northern California, it's a unique population of people, so I think that also contributes to the culture here. And it's a great one. It's very open, we have a really diverse student body. Definitely not what I thought OT school would be, but I'm so pleasantly surprised by it, and the longer I'm in this program, the more I feel like it's the program for me.